Eye color change surgeries are a dangerous trend, experts warn. There seems to be no limit to the things people are willing to do in order to achieve the perfect look, whether that's having their own fat injected into their buttocks, getting their teeth shaved down and fitted with implants, to having strips of skin from their head removed and reinserted to treat baldness. No matter how risky such cosmetic procedures are, there are always people willing to pay the price. Some people are now even undergoing procedures to permanently alter the color of their eyes. Can this be done? This can be done in a variety of ways, such as having implants to change the appearance of their iris, having their irises tattooed, or having laser pigmentation. While these procedures may give people their desired look, they also come with a whole host of risks and complications, one of which is blindness. The iris is the colored ring that surrounds a pupil. It's every bit as complex as it is beautiful. It consists of two layers of smooth muscle, which we cannot control. These muscles are responsible for shrinking and expanding the size of the pupil and iris in order to control the amount of light going into the eye. These muscles also protect the sensitive receptor cells within the eye from permanent damage. The iris also has two pigmented layers containing melanin, which determine your eye color, and there are 6 main recognized colors: brown, amber, hazel, green, blue, and gray. There's also black, of course. Now, a lot of Koreans have black. Now, if you have lots of pigment in both layers, your eyes will be a darker color, such as brown, which is the most common eye color, occurring in around 80% of the world's population. If you have less pigment in the front layer, you will have hazel or green eyes, the rarest colors found in only 2% of the population. And those with little or no melanin in the front layer will have blue or gray eyes. Fixing the problem or creating one? Surgeries on the eye, particularly the iris, are not a new thing. Eye operations for cataracts date back to the 5th century BC, and coloring scars in the eye has been around for over 2,000 years. I didn't even know that. Now, until recent years, surgeries were performed in order to reconstruct the iris or repair a defect, but cosmetic procedures to permanently change the color of the iris are now starting to become more common. Pigmentation is an example of one of these procedures. A series of small incisions are made with a needle into the cornea, the clear protective layer of the eyeball. Pigments are inserted into the layer to permanently change it, and this technique dates back around 1,000 years, with a variety of pigments having been trialed, including soot. Similarly, the use of lasers to remove pigment from the outer layer of the iris can change brown eyes into light blue or gray. Depigmentation procedure, to do this by burning away the pigment and the cells that make the pigment using a laser. This technique can only be used to go from darker to lighter and won't work on people wanting to go the other way. And this is because it's currently not possible to add or deposit more melanin into the iris if it's already absent or there isn't very much. Depigmentation was originally developed to treat ocular dermal melanosis, a condition where the pigment cells don't migrate where they need to be, causing their parts of the eye, such as the whiteness, to darken. This condition may require a number of rounds of treatment, but is usually permanent and is cosmetic alteration. Both pigmentation and laser depigmentation hold significant risk of infection as they compromise the eye's outermost layers. These procedures can also cause light sensitivity and vision changes, including blindness, thinning, and perforation of the cornea, glaucoma, and cataracts. Some patients who have had pigmentation procedures have even complained about experiencing eye pain during MRI procedures. Another procedure some people are using to change their eye color is having silicone implants inserted into their eyes. Can you imagine? One Instagram model who had this procedure done experienced significant complications, which left her with the sight of a 90-year-old losing 50% vision in one eye and 80% in the other. Others have reported similar complications too. These implants bring a high risk of infection and other complications, such as changing the shape of the eye and how the fluid within the eye exerts pressure on the optical nerve. As this nerve controls vision, blindness can occur if it's compressed. There is not sufficient evidence to support the use of any of these procedures cosmetically. As with so many things that are done for cosmetic reasons, a short-term gain sets you up for potential long-term pain. Even when these procedures are used to treat medical conditions, complications are reported. And if you're considering undergoing one of these procedures, ask yourself if it's worth potentially going blind just because you don't like the color of your eyes. A long-standing safe way to change the color of your eyes is to use prescribed colored contact lenses instead. This is from the conversation here under Creative Commons by Adam Taylor, Professor and Director of Clinical Anatomy Learning Center, Lancaster University on Science Alert. Please leave your comments and thank you for your support. Finally, support my Patreon account. The daily posts are 5 videos daily, and they are totally different from what I have on my YouTube channel. Thank you so much for your support and that you find all my content so interesting. You'll find the Patreon account details in the description box below.